Hi guys, welcome back to my channel. My name is Nurse Renee. If you are new here, welcome. If you're a returning subscriber, thank you for returning. I greatly appreciate it.
Just wanna be your girl.
Today we're going to talk about mental health and nursing. I am a nurse. I've been a nurse for the past 19 years. I currently am an occupational health nurse and I do ER on the side. I truly love being a nurse. However, I am aware that bedside nursing can lead to ultimately burnout, especially if this is something that you do and you have been doing for a long time. In healthcare, right, most of the time if you are a nurse or any type of healthcare professionals, we usually work an 8-hour if you're doing some type of clinical work, or if you work in a hospital, we usually do like a 12-hour shift. So as you guys are aware, when you come in as far as being a nurse, right, you are ultimately responsible for the patients that you get report on as soon as you walk in the door. So at the top of the day, you get that list of patients that you are responsible for, and you are doing everything for that patient throughout your 12 or 8-hour shift. And sometimes it becomes difficult to do the small things, use the restroom, take a 10-minute break. Usually jobs provide you with 2 10-minute breaks and a 30-minute break or an hour break. It just depends on the job that you have, right? But sometimes in nursing, those small things become very difficult because you are constantly taking on patient care, and that patient care sometimes can seem way more important than the small things. But I'm here to break it to you. That's not the truth. You need to, at some point in time, set boundaries. You need to set boundaries. Sometimes it's important to do those type of things in order for you to be your best self for the patients. I practice meditation. I practice also working out daily. Take some time out for yourself and do some things that can calm your mind and also make you your best self before you walk in the door and take the stage, right? It is important for me to bring this issue to my channel because lately, if you guys have noticed in the news, we've run across a few articles of nurses actually, ending their life, and that is the sad part. And it's really sad for me because, we are in a job where we have to give and be so selfless, and sometimes we are so enamored with everything that we have going on when you first walk into the door, and we forget about us. We forget about being our best self. And so it's important for me to bring this topic to this channel because I think that it's important no matter what age you are, no matter what profession you are in, but definitely as being a healthcare professional, as a nurse, and with me being a nurse for the past 19 years, it is important for me to let you guys know that you need to put yourself first. If you're a person like me as well, you suffer from anxiety, or you suffer from depression, or you suffer from any type of mental illness where you need to put yourself first before you can actually put another person before you. And as a nurse, it becomes difficult because, like I said, when you first walk into the door, you clock in, the first thing you do is go get reported. You take on the responsibility and the onus of that assignment. And it's not like you're taking on an assignment of nothing. You usually have patients that you're taking on, and then you have more than just that one patient for the most part, a lot of times if you're doing bedside nursing. So it becomes a little difficult sometimes just to squeeze a little bit of you in there. But I'm here to tell you, it is important. You have to set some type of boundaries and squeeze a little bit of me time in your daily work. And I know that's it's easier said than done. It is, because there's times as being a nurse, you don't even get to eat, you don't get to use the restroom, you don't get to have a lunch break. It is just times where you just cannot get away from the assignment because there's just so much things going on and on and on. Me being an ER nurse, I can honestly say, there's times like you just getting landed back to back. You don't know when a person is going to be hurting. You don't know when that person is coming to your pod. You just you're in there, and that's the job that you are here to do. And I'm not complaining. I'm just saying that these are things that you have to make sure that you set boundaries for and take 5 minutes for yourself. take a few minutes to step away from the situation to recollect yourself and then go back so that you can be your ultimate best self. And, so I think it's important for you to find some things that can help you relax. If whether that's meditation, finding a quiet spot, journaling, maybe just listening to some soft music, or just even peace and quiet. Calm yourself down, recollect yourself. Then you can reconvene, and get back out there on the floor. Another thing as nurses, I want to make sure that I preach is burnout. I know a lot of nurses, we go for the money. We going to get our money. We want that overtime a lot of times, and we just, we see the possible income stream that we can have, and so we trying to go get it, right? So with that being said, I'm all for go get the money, but I'm also, team human. You are a human, you're not a robot, so you're going to need to sometimes set boundaries and take some time off for yourself. It's okay to take some time off for yourself. It's not you being selfish. It's actually you putting yourself first so that you can be your best self, so that you can continue to help other people. So these are things that I think that you should consider, especially, like I said, with the last few cases I've run into, especially with, my fellow nurses, deciding to, in their situations the way they did. I think it's important for me to just, preach on my station. My channel, more or less, it is just important to take care of yourself. It's important to do things that makes you feel better. Take a walk, do a 30-minute little exercise if that helps you out, but take some time for yourself. You are important, and you are worth saving yourself. You are worth it. You are. You can't be an advocate for someone else without advocating for you. So put yourself first. Think of some things that can help you. I hope these tips help you. Thank you for watching. If you are new again, if you like the information, subscribe. To all of my returning subscribers, thank you. And please feel free to share. Have people come and join the channel. I greatly appreciate it. Until next time, I'm out.
I just finished all you.